Hello, hi everyone, it's Dr. Erica. Thank you for joining me on this particular video. I am talking about DUONEB. DUONEB, as you may have known, is a solution for inhalation for patients who are dealing with chronic lung disease, obstructive lung disease, also known as COPD. COPD is prevalent in patients who are more elderly, patients who are uh, have a history of like emphysema and bronchitis and are using other inhalation medications as well. So this particular DUONEB is a 4 times a day dosing or inhalation, and it comes in solution form. It has two components to it. It's going to be albuterol and ipratropium. Albuterol and ipratropium work together in this solution to cause an immediate reaction where the patient has that very immediate relief of uh, constriction of the bronchioles, and they have increased ventilation and increased airway production. So this particular medication is one that I want to talk about. So stay tuned to the end of the video. Hi, thank you for joining me. This is Dr. Erica again. I'm pleased that you're with me. Please like, share, and also subscribe to this channel. I have over 200 videos about medications, how to be a successful career survival uh, in the field of medicine and pharmacy. Also, there's a podcast about that I would like for you to join. And then also, I talk about different types of not only medications but disease states as well. So do please be aware, and please like, share, and subscribe as well if you haven't already. And I do appreciate you joining me. So this particular video is going to talk about DUONEB, which is albuterol and ipratropium solution, and it's special to me because it's the first prescription medication that I ever dispensed as a pharmacist, and it's very important to me because the patient that actually came into the pharmacy to have it filled was an elderly patient. And DUONEB is for COPD or constructive um, or, or chronic obstructive lung disease patients, and these patients are usually going to be elderly. And so it was an emergency type situation. So I was ready to fill the prescription and ready to refill the prescription for. And it was something that means a lot to me because that prescription, was something that she really needed, and it was something that was urgently needed at that particular time. And so I was able to fill the prescription and get it out to her right away. And I let her know that if there's anything else that I could do, please let me know. But otherwise, the emergency room was something that she would have to consult, someplace she would have to consult for future type situations. So now this particular medication is something that is um, available, readily manufactured, and it comes in generic form and it comes in the brand name form. Most patients will get this prescription as the generic form, and they'll receive it usually about a month's worth. They use it 4 times a day, inhalation via the machinery, nebulizing machinery, and then they receive again 4 times a day dosing or inhalation, and then they'll receive usually a month supply or up to 3 months supply, depending on the coverage for that particular patient. And there are some side effects that I listed in the description for you, and a lot of those side effects are very small. So the patient may not experience these side effects. It just might be something that you need to just take in consideration. Okay, there may be also some worsening with other medications, such as the potassium, and also um, certain classes of medications. If you're a patient who uses digoxin, then you want to use this medication with caution. And then also patients who are having a hypersensitivity, those patients should maybe consider not using this particular medication at all due to the fact that there's an allergic reaction to it. Okay. Now, ipratropium is a muscarinic blocker. And when I say that, the medication is going to block secretions in the lungs, help to clear the airway out, stops the bronchioles from releasing these secretions so that ventilation can occur and occur effectively. Also, the it's going to open up the airways, so it's going to cause a dilation of the bronchioles as well. Now, the short-acting beta agonists, or the albuterol component, which is found in other type of inhalations, such as the asthma pump, this type of beta uh, antagonist is going to work by opening up the bronchioles, having that ventilation to occur. And so that's what we want. Okay, so do be aware of that. Now, those two components are only for inhalation only. They don't work systemically throughout the body. They stay in that location. Once inhaled properly, they stay in the location where they can work and work effectively. Okay, so there's no systemic, usually no systemic absorption is what I'm trying to get at. So do please be aware of that. And some patients have experienced side effects that are systemic. However, they are, again, very insignificant. Also, before I leave this particular video, just know that DUONEB has 3 milligrams of the albuterol component and 0.5 milligrams of the ipratropium component, and the solution is very sterile. And so once the package is open, do refrain from excessive handling and so forth, unless it's actually going to be for a treatment. So this particular medication is, again, sterile, and it's for treatment purposes only, for patients who just want to make sure that they can refrain from hospitalization and so forth. So that's what I want you to know for this particular video, and that this particular medication was one of the first prescriptions that I actually refilled as a pharmacist back in 2013. And so I was, again, working the pharmacy, and I had a customer to come in and say, well, I'm completely out, can I get one box, and I can pay out of pocket if I need to. And so, I went through the system, refilled it for her, and she was ready to go. And that memory never left my mind, but I do remember it. So that's what I wanted to relate to you, and I hope that this has been a helpful video. Please like, share, and subscribe. Leave comments about any topic suggestions that you would like, and I hope to see you on my next video. Take care. Bye-bye.